me free. You make me win every way.
Good morning, good evening, good afternoon. This is Dr. Penn with Pinpoint Chiropractic. I wanted to talk to you about a headache that you can get from having TMJ. Your transmandibular joint can cause you pain when the teeth are misaligned, however they may be from side to side, anteriorly or posteriorly. Sometimes you went to the dentist and you had your mouth open for an extended period of time, or you grind your teeth when you sleep, or you grind your teeth when you're awake. Some people wear a mouth guard because they have TMJ and they grind their teeth down. I had a patient recently who came in and she told me that my teeth are hurting so bad, they hurt to touch each other, and I'm having some really bad pain. And I said, okay, come on in and let's take a look. Let me evaluate. And sure enough, she did have some transmandibular joint issues. And in that, I began to work the muscles, the masseter muscle, which is the biggest muscle that you have in your jaws, and it helps you to chew. Masseter, like you're masticating, eating, and or you're grinding and you're shifting your teeth one way or another. However, when I began to evaluate her neck was so tight that it was painful for her to move it, and the muscles were so tight. As I began working and doing myofascial work on the neck to release those muscles, um, they were just incredibly strong with pain from uh, chewing in your sleep, per se, by grinding your teeth. And so um, that caused this patient to really have some jaw pain, some teeth pain, headache pain, neck pain. But she didn't have shoulder pain, which was very interesting because she thought that her shoulders would be tight, like as in a person who may have a tension headache, but not a tension headache. That pain came from her neck, affecting her jaw. So you can have TMJ that causes you to have headaches after dental work. If you are a worrier and you clench your teeth and you chew your teeth, and that is one way to help your emotions subside. However, if you don't fix the emotional problem, then it will show up sometimes in your teeth through stress. And so I just wanted to talk to you about TMJ. Sometimes people don't catch it, and not all chiropractors adjust the jaw in such a fashion that it would help patients alleviate pain. The other thing that we did was we went on the inside of her mouth and we stripped some muscles. In the back, they're called pterygoids. On the outside, there's an external pair and an internal pair. She had a lot of scar tissue that was actually inhibiting her from opening her jaw. So we worked that area a little bit too by stripping those muscles and then having her do some jaw exercises. And so the tongue is actually the strongest muscle in the body. Just think about what the tongue does every single day. It moves food. It and a lot of food. You're eating tons of food in a lifetime, and the tongue is able to help the teeth move the food from the mouth to the other parts of the digestive system. So, in using the tongue and doing exercises with the tongue, I have found that it has helped people with TMJ because it helps realign their jaw. Yes, it does. And if you would like to know more information about these exercises for TMJ, please like, share, and subscribe to us. Get on our email list so that you can get some tips, and get on our mailing list, which would have these tips about what you can do, what exercises you may do for TMJ and headaches that are caused by that. I hope this is very helpful. I hope you tune in. Please check back and look at some of our previous videos that talk about the different types of headaches so that you can identify, but not diagnose yourself. go and see a professional to get diagnosed. Once again, thank you for staying tuned to Pinpoint Chiropractic's YouTube station. We hope that this is helpful. We hope that you like it. We hope that you share it. And we hope to see you again. Thank you.